Thank you for joining us for the special edition of KPBS News. I'm Maya Trabulsi. San Diego might be on the verge of something we haven't seen in months, a less restrictive reopening tier. Since December, San Diego County has been in the most restrictive purple tier, but in recent weeks, case numbers have been declining sharply. We'll learn Tuesday if we've reached the level needed to open gyms, expand business capacity, and more. In the meantime, kids will be returning to youth sports sooner than expected. KPBS reporter Matt Hoffman has the story.
This is a good day.
Torrey Pines High School head football coach Ron Gladnick got emotional over news of a settlement, which attorneys say will allow youth sports indoors and outside to resume play statewide.
We worked every day to try to get to this place in time.
Gladnick, along with the Grassroots Let Them Play coalition, made up of parents, kids, and coaches, have been negotiating with the governor's office for weeks.
It really just shows that these coaches care a lot more about us than just the winning football games. These coaches all really care about us as kids.
Nick Gardenera is a football player at Scripps Ranch High School who was a plaintiff in a lawsuit against the state. It recently resulted in a judge temporarily allowing all youth sports to resume in San Diego County, and the state did relax some restrictions for outdoor sports, but the group kept pushing.
I think of a kid like my son, which is obviously my why in a movement like this, who's got a 4.0. He's got some offers, but he really wanted to show what he's been doing for many, many years.
Marlon Gardenera is Nick's dad and the head football coach at Scripps Ranch High School.
Last Friday, when my football team took the field for the first time officially, I said it felt like spring had come early. Today, for all high school athletes in California, Christmas has come early.
Attorneys representing two athletes say they have a court date tomorrow in San Diego. That's when they plan to present the settlement that, like the pros, will require safety protocols and regular testing for student athletes.
Indoor sports will be allowed with testing within 48 hours of competition, and then periodic testing as well during the weeks.
Attorneys say those testing requirements will go away once the virus has low transmission rates. While a settlement appears to have been reached here, the fight continues in court for some local restaurants and gyms. A judge has again denied a request by attorneys representing businesses including Cowboy Star Restaurant and Bear Republic to reopen indoors at a limited capacity. Matt Hoffman, KPBS News.
And following this report, the state has updated its guidance for youth sports. It essentially requires the same measures and safeguards as college sports, which include testing and contact tracing. San Diego Unified plans to reopen its classrooms on April 12th, but a deal reached in Sacramento will now offer an incentive to move that date up. Education reporter Joe Hong tells us how local schools might try to take advantage of that offer.
Newsom and state legislators announced a new school funding plan Tuesday that will provide an additional $6.6 billion for school districts statewide that are able to bring students back to campuses for in-person learning.
We incentivize opening up our schools by providing real resources to do it.
The money will be split into two allotments. The first is $2 billion for districts that can open TK through second grade before April 1st. To qualify, districts must have a 7-day average case rate below 25 per 100,000 residents. Those that reopen after the deadline can still qualify for some of this funding, but they'll lose 1% of their allotment for every day campuses are closed after April 1st. The state's remaining $4.6 billion will be divvied up among all districts and be targeted towards addressing learning loss during the pandemic. Districts will be able to use this money on a range of things, from purchasing more PPE to extending the school year into the summer.
Once you dip your toe in, once you build a cohort confidently, once you build trust, then we will start to see a cadence of reopening across the spectrum. But again, on the basis of building confidence and trust.
San Diego Unified School Board President Richard Barrera says the district could qualify for up to $100 million of this additional funding. However, last week, the district announced it will begin its next phase of reopening on April 12th. But since the district's spring break is the last week of March and teachers are scheduled to be back on April 5th, Barrera says the district should still get a full share.
It allows us right after spring break to have a week where the staff is on campus preparing and getting trained in all the mitigation strategies that are necessary to keep everybody safe in order for us to be able to then bring students back on April 12th.
Another caveat is that in February, district officials reached an agreement with the teachers union to not reopen schools until after all teachers are vaccinated. Teachers union president Keisha Borden said they will not be changing the agreement to meet the state's April 1st deadline.
Many educators received their first dose of the vaccine over the weekend. Most of those educators received the Moderna dose, which requires 4 weeks between doses. So I'm not sure if an April 1st deadline is even possible.
The state legislature will vote on the funding this Thursday. Joe Hong, KPBS News.
Governor Gavin Newsom signed that bill into law Friday morning. He was joined on a Zoom call with educators and lawmakers, including San Diego's Tony Atkins, who played a key role in moving the plan forward as Senate president. California saw hospitalizations skyrocket around the holidays, and when staffing couldn't keep up, the state let hospitals put more patients on a nurse's workload than law would usually allow. In the first of a two-part series, KPBS health reporter Taryn Mento tells us how nurses felt pushed to the brink and questioned whether it was even necessary.
It's been a long year for nurse George Santiago.
If you have responded to multiple code blues in one shift, that really drains you.
Code blue means a patient is near death. Santiago's job is to rush toward those calls as a rapid response nurse at Palomar Medical Center, Escondido. And he carries the extra burden of often being a patient's last contact.
I'm picturing myself, if this was my family member and there's nothing I can do, the desperation, the hopelessness, that is what kind of kills you.
The weight grew heavy during the late 2020 surge. Palomar received state permission to stray from a landmark law that limits the amount of patients under a nurse's care. Staff could now be asked to take on 1 to 2 additional patients.
Here, why don't you carry this pile of bricks while you're trying to tread water? So that's the equivalent.
Palomar is one of more than 200 California facilities that received temporary staffing waivers during the pandemic. Governor Gavin Newsom expedited the waiver process when COVID-19 patients skyrocketed late last year, but staffing did not.
Just stretching resources, and again, empathy and respect to those human beings, these frontline healthcare workers, these nurses in particular that are just doing heroic work every single day, asking yet again for a little bit more during these very challenging next few weeks.
The state health department declined an interview, but said in an email waivers should be a last resort. The waiver application says hospitals should exhaust alternatives before seeking one. But the state said in its email that facilities actually don't need to. And the KPBS iNewsSource analysis of publicly posted waivers found dozens did not document they tried all listed alternatives before seeking the waiver.
The process is easy. The process can be approved in as little as 8 hours. And then there you go.
Stephanie Roberson leads government relations for the California Nurses Association. She says under the expedited process, a staffing waiver could be granted in less than a day. The union has protested against the waivers, including at Palomar. Roberson says they've successfully contested 3 of the at least 43 waivers that have been rescinded in the state.
And the ones that have been rescinded are because we're saying on the ground, we're looking at your form, and number one, you haven't checked any of the remedies.
The application form asks hospitals what other options they've tried. That includes transferring patients to other beds, rescheduling elective procedures, and possibly setting up clinics for non-emergency cases. The KPBS iNewsSource review found about half of approved hospitals did not report they tried all options, including some in San Diego.
Parameters aren't strictly adhered to. It's just, quite honestly, to be quite frank, it's just a formality.
Most local facilities that received waivers declined or ignored requests for interviews. But Santiago says the waiver didn't need to happen at Palomar. The facility laid off more than 300 staffers when patient tallies dropped last April.
Most of which, of course, we can't get back now because they're not going to hang around. They're going to look for other sources of income.
Applications ask if hospitals experienced layoffs within the last 2 months. The Palomar layoffs were several months before Santiago says the Escondido facility applied. However, the details of its application are not posted on the state's website. But Santiago says the Escondido facility did not cancel elective procedures before getting its waiver.
Which was even more difficult for the recovery room nurses because they have their load of people that they have to recover from surgery, and then they have to handle COVID patients too.
Santiago says the union filed a grievance because Palomar did not communicate with them before getting a waiver. Palomar refused requests for an interview, but a spokesman previously said claims of unsafe working conditions were inaccurate and called them appalling and irresponsible. All expedited waivers were due to expire last month, but at least 84 hospitals received extensions until the state provided additional staffing resources. Taryn Mento, KPBS News.
As Congress tries to pass another round of COVID relief, some states are disregarding public health advisories. Mask mandates are out and businesses are reopening without restrictions. Martin Savage tells us how politics are becoming a bigger part of the recovery.
In less than a week, the state of Texas will stop requiring masks, and businesses can operate without any restrictions, going against the advice of health experts.
Now is not the time to release all restrictions. Every individual is empowered to do the right thing here, regardless of what the states decide.
The rule changes frustrating some local leaders.
It's going to lead to a lot of chaos, confusion, and conflict.
And healthcare workers in Texas fearful of another dangerous surge.
To say that I'm petrified doesn't even really explain the gravity and the depth of my feelings.
From the Oval Office, President Joe Biden calling it a big mistake for states to lift restrictions.
The last thing we need is the Neanderthal thinking that in the meantime everything's fine, take off your mask, forget it. It still matters.
Texas Governor Greg Abbott's office responding to Biden's criticism, writing in a statement, "It's clear from the recoveries, the vaccinations, the reduced hospitalizations, and safe practices that Texans are using that state mandates are no longer needed. We must now do more to restore livelihoods and normalcy for Texans." And Mississippi's governor also pushing back, just hours before the state's mask mandate and business capacity limits expired.
Given how long ago Mr. Biden was elected to the U.S. Congress, he certainly should know how Neanderthals think. Mississippians can make their own decisions. They can assess their risk.
But according to Dr. Anthony Fauci,
from a public health standpoint, is ill-advised. You're only going to set yourself back if you just completely push aside the public health guidelines.
And health experts say it's key to wait for more people to get vaccinated and have a lower number of new coronavirus cases before removing pandemic restrictions. A reality seemingly in reach as the Johnson & Johnson coronavirus vaccine continues to arrive across the country.
I would just plead with people, just give it another month or two. Let us get as many people vaccinated. Let's control this new variant before we start to relax on mask wearing and these other measures.
And that was Martin Savage reporting. San Diego County gave its 1 millionth vaccine on Friday. That's a big number, but many of those shots aren't reaching the neighborhoods where they are needed the most. Joe Hong explains what's being done to change that.
These are the vials that contain 5 doses each.
The governor's office will now be reserving 40% of all vaccinations for those residents living in the most disadvantaged areas in the state. Newsom emphasized the disparities in the communities that have had the highest COVID-19 case rates during the pandemic.
Just consider low-income households earning less than $40,000 a year have been impacted by 2 times those in households whose incomes are north of $120,000. They've been impacted by multiples.
Despite these disparities, the distribution of the vaccine has favored wealthier communities.
At the same time, insult to injury, households earning over $120,000 have twice the access to vaccines than those communities that have been disproportionately impacted. That is what we have to reconcile.
With the new policy, state officials said they will ensure that more vaccines arriving in disadvantaged communities will end up in the arms of the local residents who need them the most. The 40% of all vaccines will be distributed to about 400 underserved zip codes statewide. Most are in Los Angeles County and the Central Valley, but several zip codes in the South Bay will also benefit. Nora Vargas is the county board supervisor representing the region.
I am ecstatic about it. This is what we've been fighting for from day one, right? I mean, I think the board, advocating for health equity, this is what health equity is all about.
South San Diego County is home to more essential workers who are more likely to catch and spread the virus. The zip codes in this part of the county have also had the highest infection rates throughout the pandemic.
The Latino community has been most impacted disproportionately by COVID-19, especially in the South Bay. And so if we're going to reach herd immunity, we have to make sure that we take these bolder steps, as the governor said.
So far, 1.6 million doses have been distributed to Californians living in underserved communities. The governor's office announced on Thursday that once 2 million doses have been distributed, the threshold for exiting the most restrictive purple tier will be relaxed from 7 daily cases per 100,000 residents to 10 daily cases. Joe Hong, KPBS News.
As the county opens more vaccination sites, KPBS has you covered. To find one near you and its hours of operation, go to kpbs.org, and from there you can click on the Tracking COVID-19 link. A new program launched this week that will help local businesses. Renters cover past due rent and utility bills. The county's emergency rental assistance program is funded by over $100 million in state and federal grants. And to be eligible, you must be renting and have experienced a financial hardship related to the pandemic. There are some income restrictions, however, and you can find more on that. And you can also apply at sdhcd.org. Housing is also a problem to our east. Farm workers in Imperial County have long suffered from low pay and few options. iNewsSource investigative reporter Jennifer Bowman tells us how COVID-19 has only made things worse.
In Imperial County, agriculture is king, a $4.5 billion industry. So even during a pandemic, people who live in Mexicali still cross the border for work. Quesifredo Figueroa is one of them.
Como yo estoy con la bendición de Dios, que no tengo miedo, tengo fe en Dios, que no suceda nada de eso, que no tengo temor. No tengo temor en nada de eso, pero sí que cuidarse uno, es así.
Farm workers have come through Calexico for decades, and many live in Mexico because of their low wages. Alex Cardenas is with Vo Neighborhood Medical Clinic, which is helping farm workers with isolation housing. Cardenas says even before COVID-19, the workers weren't always welcomed.
Don't use the restroom unless you're a paying customer. You know, you can only be in the restroom for 5 minutes, no bathing. So imagine you walk into this restaurant and there's all this signature and signage basically not welcoming you.
Now, an encampment has popped up just steps away from the border. It's being used by farm workers, some of them homeless, and others trying to avoid the long commute.
Aquí en Calexico está muy difícil para buscar, encontrar cuarto o departamento. El departamento que hay es muy caro, son $1,200, pero mi trabajo no me permite para tanto.
Calexico officials are now seeking grants for permanent housing. Councilmember Raul Urena says he's seeing more farm workers sleeping on the streets during the pandemic.
This community is very much in solidarity with the farm working community because all of us, including myself, have had parents and grandparents working these very fields so that at some point my generation was able to go to university or was able to at least get a job outside of the fields.
The state is spending an extra $24 million to help farm workers. The money will go towards services to help those isolating because of COVID-19 and financial assistance. For KPBS, I'm iNewsSource investigative reporter Jennifer Bowman.
iNewsSource is an independently funded nonprofit partner of KPBS. Animals at the San Diego Zoo have received their own version of the COVID-19 vaccine. The recipients include an orangutan who received open heart surgery in 1994, the first such animal to undergo that procedure. Other orangutans and some bonobos also received an experimental vaccine from a company founded by Pfizer. The zoo says there were no adverse reactions and the animals are doing well. That's not the only news the zoo made this week. The organization launched a major rebrand to reflect an evolving mission. Environment reporter Eric Anderson says it takes a more holistic approach to conservation.
Two African elephants, Swazi and Nisa, eagerly reach out their trunks, searching for a treat from lead keeper Lauren Coates.
Their skin's super thick and strong, but it's really wrinkly. It's kind of like a tire, like how it has some give to it, even though you can tell it's super strong. And it's super wrinkly, and they have hair all over their body. You can see it here on the trunk, but it's really thick like wires.
Coates reaches into a bucket full of cut-up sweet potatoes, cucumbers, and food pellets.
You need that food?
The keeper says the elephants get treats a couple of times a day as part of their training.
And they should respond to their names. And if they choose to come over, they get reinforcement for leaving, what they were doing and coming over. And then we'll walk away when we're done, and they get to go enjoy all their treats again.
Coates says the elephants have choice and control over what they do in the yard. The treats are a way to reinforce positive behaviors.
In the beginning, it's just getting them to know their name, just to come to us when they're called. And then we can move into more complicated behaviors like blood collections, milk collections, things like that we can use for different studies.
The 2 moms in this 9-elephant herd have been part of a more than year-long study of elephant milk. Keepers regularly take samples from lactating moms and analyze the milk's composition. Researchers are trying to measure how elephant milk changes over time so they can help orphan elephants in Kenya. Workers at the Riteti Elephant Sanctuary can make age-appropriate formulas that can be the difference between life and death for elephant calves. That connection makes the work in San Diego even more important for both researchers and keepers like Coates.
The work that they do every day is helping animals and plants in the wild.
Nadine Lamberski is the organization's chief conservation officer. She says the new San Diego Zoo Wildlife Alliance name reflects a holistic approach to conservation.
It is about wildlife. It's also about people. And it's also about, again, the ecosystems that we share. And it's that balance of nature that becomes so important in our work.
She says the concept hit home recently when the coronavirus infected the safari park's gorilla troop. It was the first ever case of human-to-gorilla transmission. Several members of the troop were infected, and the silverback got monoclonal antibody therapy. All have recovered, but Lamberski says the situation offered a lesson.
This is an infection that originated from animals and then went into people, and unfortunately, people transmitted it back to animals. But it goes beyond just that. We had a meeting just the other day with our colleagues that work with great apes in the wild, and we talked about how do we protect wild gorillas? What needs to happen to make sure that they don't suffer consequences because of the exposure to this virus.
In fact, COVID-19 helped push the zoo to change the way it does business around the world. San Diego Zoo CEO and President Paul Barabalt says the zoo was making incremental movement in that direction anyway, but the pandemic accelerated the change.
Through this past year, we've all seen how our own human health is tied to the health of wildlife, is tied to the global health of the planet. And so in so many ways, COVID was the catalyst that said, we have to do this now.
Barabalt says the San Diego Zoo Wildlife Alliance brings research skills to the table, but he says that's not enough for a complete solution which engages communities, governments, and other wildlife organizations outside of San Diego.
For us to have a greater impact in conservation, we needed to use this moment to energize everybody, all of our partners, all of our donors, all of our supporters here in San Diego, to be a part of this solution.
Barabalt says the new focus doesn't mean the 2 parks will be ignored. He says those parks must thrive for the organization to stay financially healthy. Barabalt says the animals, like the African elephants at the safari park, help connect local visitors to the organization's research work. Eric Anderson, KPBS News.
This month, we'll be going into the KPBS archives to mark pandemic life 1 year on. March 2020 is when things changed dramatically in San Diego. It's also when our community stepped up to help those in need, including our pets. Here's the story from KPBS reporter John Carroll.
Here for some dog and cat food? Dog?
In front of the Humane Society, volunteers and staff are living up to the society's name by doing something truly humane for our 4-legged friends.
So we're here as a resource and as a safety net for our community. We want to keep pets out of the shelter, so we're here providing pet food daily from 10 a.m. to 4 p.m. to any family that is short of that resource.
I'll do one big bag for you guys.
The Humane Society program that Geraldine Da Silva heads, PAWS San Diego, typically helps low-income people with their pet food and supply needs. But now the need has grown because in many places the shelves are empty.
Either the lines are long and we have 5 kids at home, or there's no dog food, no cat food at the Walmarts.
Yeah.
You know, if you're not there just in time to get it, it's gone.
Hi, here for some food?
Animal care specialist Cassie Edmond is usually inside working at the Humane Society. Today she's outside and loving it.
I feel like I'm making a difference today and just helping people that really need it. You know, some people can't go out and go to Walmart and stand in line, so we're their resource and helping them out.
As long as their stockpile holds out, the Humane Society will continue giving out food every day between 10 and 4. The Humane Society is distributing pet food and supplies at more than just its 3 campuses here in San Diego and Oceanside and Escondido. They're also sending out those supplies to the San Diego Food Bank, to Elder Help, and to the San Diego Unified School District, and they are then distributing those supplies. Yet another way that the community is coming together in the age of COVID-19. John Carroll, KPBS News.
The PAWS name was retired last summer, but the Humane Society is still offering food assistance to pet owners. The organization says the name change is part of a strategy to expand its reach. You can get more information at sdhumane.org. And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and for all of us here at KPBS, thanks for joining us and stay safe.